Good morning. My name is Annalyn Gagarin, and I will be presenting a strategic plan on how to decrease employee turnover rates at U.S. Renal Care, specifically here on Guam. A little bit about the company. U.S. Renal Care clinics provide in-center and at-home hemodialysis and peritoneal dialysis services for end-stage renal disease. U.S. Renal Care also manages several acute setting dialysis programs in conjunction with local community hospitals. U.S. Renal Care not only support facilities with experienced clinical and operations staff, it also delivers the highest quality of care. The physicians play a critical role in the care being provided by the company. But beyond that, physicians play a critical role in the business model. U.S. Renal Care runs its local facilities through partnerships with physicians who serve as medical directors as well. U.S. Renal Care was founded in 2000 and it is based in Plano, Texas. It serves over 23,000 patients across 31 states and the territory of Guam. Its facilities are managed by local physicians, and by far, its clinical results exceed national averages. U.S. Renal Care mission is simple. The company wants to be the highest quality provider available to patients with chronic and acute renal disease. And to accomplish this, the company partners with the best nephrologists in the country by providing the best trained professional staff in each of its facilities by demonstrating ultimate customer service, offering state-of-the-art technology, and by constantly educating patients and family about the disease process. As a result, we have excellent patient outcomes and the best service available. U.S. Renal Care stands out above other providers by 1. Being patient-focused. By being patient-focused, we do our best to provide compassionate care where and when patient needs it. 2. By partnering with leading physicians. We work with quality physicians who provide quality care to patients and also lead our facilities through joint venture partnerships. 3. By committing to the communities we call home. In each of our locations, we work closely with elected leaders, nearby hospitals, physicians, and advocacy groups. 4. We offer an experienced team of nurses, social workers, dietitians, acknowledging that quality care requires a quality team working in conjunction with a highly qualified program. 5. Offering state-of-the-art technology. Every piece of the equipment is top of the line, from at-home and in-center dialysis machines down to the therapeutic chairs in our facilities. 6. Delivering care in a healing environment. We design our centers with patients' healing and comfort in mind, promoting a relaxing experience in a soothing environment. And lastly, educating our patients and family. We work closely with patients and their families to help them understand their disease and their therapeutic options. This is very critical in order for them to maximize the benefits of therapy. Moving along to the identified strategic goal. U.S. Renal Care Management should improve and develop employee benefits and/or incentive programs to retain loyal employees and decrease employee turnover rates within the company. This will allow employees to be loyal to the company, and the company will not lose employees who are fully trained and qualified to perform the duties and responsibilities of a hemodialysis staff. The company and the employees will both benefit from this outcome. On your screen, you'll see the strategic map with the 4 main areas: financial, customer, internal, and organizational, learning, and enablers. On top of the map, you'll see how my goal is to decrease employee turnover rates. U.S. Renal Care nationwide struggles to retain employees due to lack of employee benefits and/or incentive programs. Therefore, employee turnover rates have increased over the last 5 years I have been employed with the company. When I was offered a position as the new registered nurse, I thought the pay was fine, until I found out what the hospital and clinics offered was way more than what they offered me. I took the offer because it was my first job and wanted experience. Throughout the 5 years I have been employed with U.S. Renal Care, there was no annual bonus or other incentive programs besides the excellent health insurance the company offers for its employees. There is an annual increase ranging from 10 cents to 70 cents, nothing higher than that since I started working there. I have talked to my nurse manager over the years and she has brought it up to management, but still nothing was done. If U.S. Renal Care offered a competitive starting salary, offered incentive programs such as annual bonuses, like what other companies offer, such as DaVita, and improved benefits other than healthcare insurance and 401k, employees will likely stay after training was provided. The training consists of a 6 week on and off the floor training with new employees, and the company spends almost $6,000 per employee. In return, we lose that employee after the 6 week period is over because of the pay issue. Our outpatient facility has over 100 patients, and the patient to staff ratio at times can be overwhelming. We have hired both dialysis technicians and nurses. However, after a month of training or less, we lose them to other employers due to salary. U.S. Renal Care need to focus on retaining employees who are well-trained, loyal, and trustworthy. In order to do so, the management should focus on employees' concerns, such as incentive programs and increasing salary offer or annual increments. The cost of living on Guam have risen over the years and comparable to some smaller states. If U.S. Renal Care develops an incentive program, improved benefits, and increased salary offer, the company will spend less on training. Therefore, it would benefit both the employees and the company, therefore decreasing the turnover rates significantly with employees. The arrows indicate what will eventually lead to decreasing employee turnover rates with each of the four main areas. In order to implement the strategic goal, there are 3 things that can be done: improve employee benefits, develop incentive programs, and increase salary offer. In order to do so, standing plans can be utilized to improve the existing policy on employee benefits to retain employees. Some ways to improve employee benefits may include increasing the numbers of paid holidays and pay employees double pay rather than time and a half. The average pay for nurses and patient care technicians with other U.S. Renal Care in the mainland are $30 an hour or $13 an hour respectively. The pay on U.S. Renal Care Guam should be comparable to those rates because the cost of living is comparable to some of the states. Lastly, incentive programs such as annual bonuses or quarterly incentives should be implemented to encourage employees to be loyal to the organization. Employee turnover rates will significantly decrease if the plans mentioned are implemented. To implement the strategic goal, downward communication will be utilized. This will include the stateside management because U.S. Renal Care is based in Texas, and then locally we have our area director, facility administrator, and then it goes down to employees and or staff. Downward communication will be very useful in implementing the strategic goal to decrease the employee turnover rate with U.S. Renal Care by improving employee benefits, developing incentive programs, and increasing salary offer to new employees because management can see the impact it can cause within the organization. When management based in the mainland realizes the trend of employees leaving the organization, our area director, who holds the highest position here on Guam, will have to answer. The area director will then tap on the nurse managers or the facility administrators to ensure she gets an answer. When the nurse manager addresses the reason why new and old employees leave the organization, a face-to-face meeting will be held and the issue will be addressed. This form of communication is very effective because management is the first line of defense, and it triggers to the lowest subordinates within the organization by asking for their suggestions on how to better improve the employee turnover rates. Once management receives feedback from the staff, it will be brought up to the highest level to finally decide on implementing the incentive program, salary offer, and employee benefits. By utilizing downward communication, everyone is involved from the highest to the lowest ranking staff in the organization. No individual is an exception in this form of communication, and it is the most fair out of the three formal channels. Management should ensure to be consistent between the verbal and nonverbal messages that are portrayed throughout the communication as it moves down the organization to avoid distortion or loss of message content. Finally, when the strategic goal is finally implemented with US Renal Care, the results will increase employee satisfaction because you have happy employees who are well taken care of. It will increase morale. Patient satisfaction will increase as well because of the satisfied staff. Happy employees equals happy customers. The ultimate result will be with the company as it will spend less on constantly training new employees and losing them after the training period. It is wiser to listen to what employees have to say, look over it as a management, and see if it will be better for the company in the long run. That concludes my presentation. If there are any questions, please feel free to post them on our forum, and have a good day. Thank you.